When the body filters out toxic medication, such as chemotherapy or immunotherapy, it can put extreme stress on the liver. Not only is this a negative for its direct impact on the liver, but the elevated liver enzymes caused by this stress can also lead to a patient being taken off of their medication, which can change the whole course of treatment, typically for the worse. In this video, we discuss supplements that have evidence that they improve liver functioning during cancer treatment without impairing survival outcomes. As always, these ideas are discussed in more depth in the book Cancer Self-Defense 101, Quick Tips to Help You Survive. All citations for studies quoted in this video can be found in the book's bibliography at cancerselfdefense101.com. Milk thistle has been used for thousands of years in traditional medicines, normally for the treatment of liver dysfunction. The plant is capable of growing over 6 feet tall, and the herbal powder is typically made from the seeds, which contain a high percentage of the alkaloid silymarin. Milk thistle has shown many encouraging properties against cancer in cell line and animal experiments, including direct action against cancer itself and reversing multi-drug resistance. However, human trials have not been as encouraging. For instance, in one human trial, a high-dose milk thistle extract was unsuccessful at reducing prostate-specific antigen PSA levels. In another human study, a milk thistle extract did not show good penetration into prostate tissue, despite patients taking 13 grams of a milk thistle extract phytosome for 14 to 31 days. Therefore, we do not believe that the evidence for milk thistle rises to the level to be called anti-cancer, but we do believe there is sufficient evidence to recommend milk thistle for the management of liver enzymes. After 56 days of use in children with leukemia, use of milk thistle resulted in a significantly lower liver enzyme, AST, and a trend towards significance in another liver enzyme, ALT. An additional modest synergistic effect with vincristine, a chemotherapy, was also noted. A double-blind, placebo-controlled trial in hepatitis also revealed improvements in liver function with milk thistle over placebo. A problem with milk thistle is its low bioavailability. This has been resolved by the supplement Legasil. Legasil shows dramatically increased bioavailability and dramatically increased brain penetrance. One case report on 3 people with brain metastases describes how Legasil led to a more than halving of the size of the metastases. An MRI of tumor shrinkage with the help of Legasil, and a chart depicting tumor size after different therapies. Another supplement that shows encouraging efficacy for liver health is tauroursodeoxycholic acid, TUDCA, a naturally occurring bile acid that is also sold as a dietary supplement. Bile acids help digest and absorb fat-soluble vitamins, break down food, cholesterol, and destroy harmful bacteria. Humans produce between 400 and 800 milliliters of bile daily. It is used in the removal of many waste products from the body, as well as bilirubin and liver enzymes. In mice, TUDCA stimulated bile flow by approximately 500%. 2 months of supplementation with TUDCA decreased liver enzymes 51% in women with biliary cirrhosis. In another study in women with cirrhosis, 6 months of 500 milligrams of TUDCA daily decreased the 4 main liver enzymes, AST, ALT, alkaline phosphatase, and GGT, by about 45%. Even just 10 milligrams per day for 3 months significantly reduced liver enzymes. S-adenosyl L-methionine, SAMe, is a compound found naturally in the body, but it has a particularly profound effect in the liver, where it acts as a precursor for glutathione synthesis. This glutathione in the short term can help repair injury, which is why SAMe has been found in numerous human trials to lower all elevated liver enzymes and even lower LDH, an acid cancer secretes to protect itself. But long-term SAMe supplementation could be more concerning, as glutathione can make cancer more difficult to kill. An animal trial has shown as much. A 17-day administration of SAMe made hepatocellular cancer easier to kill, while administration for 51 days made it more difficult to kill. To reiterate, SAMe may be dangerous if used for longer than a short burst. Dihydramycin, DHM, is a constituent of the fruit of the oriental raisin tree. These fruits have been used for centuries to ameliorate the symptoms of hangovers. DHM also exerts considerable anti-cancer force in preclinical trials. It increases the expression of the key tumor suppressor gene, EP53, induces apoptosis, reverses multi-drug resistance, inhibits mTOR, reduces promoter of metastases, matrix metalloproteinase 9. Unfortunately, these anti-cancer effects have not yet been put through human trials. DHM has, however, shown efficacy at reducing elevated liver enzymes in human trials. In a double-blind, placebo-controlled trial in non-alcoholic fatty liver disease, using 150 milligrams of DHM daily for 3 months, DHM lowered elevated liver enzymes, lowered tumor necrosis factor alpha, an inflammatory molecule, and improved glucose levels and insulin resistance. In another placebo-controlled, double-blind human trial, DHM improved blood glucose metabolism, lipid levels, and renal function in patients with diabetes. Curcumin, mushroom extracts, melatonin, and berberine have also shown the ability to improve elevated liver enzymes in human trials. For more information, see the book Cancer Self-Defense 101, Quick Tips to Help You Survive.